Good afternoon, everyone, and thank you so much for joining us today for a great discussion. We are getting started. It's right at 2 o'clock on my calendar, on my clock. My name is Lily Armstrong, and I'm a senior manager with NASTAD's Drug User Health Team. Our team supports the CDC-funded National Harm Reduction TA Center, which has allowed us to stay in close contact with syringe access programs and other harm reduction partners over the last year. We know that the pandemic has pulled attention from what was the deadliest year of the American overdose crisis, with over 81,230 people dying from drug poisoning between June 2019 and May 2020, and that shutdown conditions have increased isolation, unemployment, uncertainty in drug markets and supply, and other risk factors associated with overdose and overdose death. In the midst of all this, we want to help get whatever tools may be useful out to communities who are adjusting their response efforts. And so we are very glad to have Una Krieg and Gordon Casey from the Brave Technology Co-op today to share their work. I am now required to say that hosting this webinar does not constitute an endorsement of Brave or their products. No money has changed hands here, and this is very much being presented in the spirit of raising resource awareness and fostering relationships between stakeholders. This webinar is being recorded and will be shared on the NASTAD website following the broadcast. We will pause for questions through the Q&A box during the presentation, and then we'll open up the last 15 minutes for submitted questions or audience members who would like to speak. My colleagues Kirsten and Alika are standing by to help keep track of your questions and comments. With that, welcome to the Overdose Response Resources walkthrough with Brave Technology Co-op, and please allow me to introduce our panelists. Una Krieg has a complex history which includes sex work, drug use, homelessness, and violence. These experiences led Una to develop her skills in anti-racism, anti-poverty, and anti-colonial settings. For the past 15 years, she has been consulting, organizing, facilitating, grant writing, fundraising, and developing community programs with the intent of reducing impacts of poverty, violence, and lack of opportunity. Motivated by personal loss and the professional frustration from the fentanyl crisis, Una has turned her tremendous skill set to Brave Tech Co-op because she believes in Brave's mission as an organization and sees the importance of tech built by and for at-risk community members. Una is a writer, artist, advocate, activist, mama, lover, and we're rocking a fabulous hat this afternoon. Gordon Casey, welcome. After a career in law and finance, Gordon moved to Vancouver in mid-2016, determined to use technology to reveal that hope is always nearby as long as you can ask for it. He soon realized that the most pressing need for this kind of tech was in overdose prevention and response. He has been working in the downtown east side ever since. Joining us today from Vancouver, Una and Gordon, welcome. Thank you so much for your time, and please take it away.
Hi everyone. It's strange to know that there are 65 people looking at us right now, and we cannot see all your beautiful faces, but that's okay. We can still feel that sense of community, connection, collaboration, cohesive action through the fact that we're all sitting here today together. Thank you for such a lovely introduction. I want to, and for organizing this, Lily. This is a fantastic opportunity for us to meet other radicals, organizations, people who are doing this work. And to that end, we are based out of beautiful British Columbia, a place called Vancouver, and what I have been taught in my anti-colonial work and my anti-racist work is we do a land acknowledgement of the unceded territories upon which we are working and on which we are guests. And to that end, I would like to acknowledge that we are on the unceded and stolen territories of the Musqueam, Tsleil-Waututh, and Squamish First Nations, and that we try to tread lightly in this space and work in alignment with the other nations that exist and have existed here since time immemorial. So thank you for that. Another thing I'd like to do before we go on is to take a pause, take a moment to realize that we are in, I don't want to say unprecedented times, because if I hear one more person say unprecedented times, I'm just like, there needs to be a new word. We are in very confusing, dark, difficult, isolating times, and a lot of us have lost a lot over the past year or past 4 years. And I just want to take a moment for us all to recognize that we carry that loss, even though we're carrying it individually, like we're carrying it collectively. And so maybe just take a moment and take a breath. And if there's anyone who you're carrying, who you're missing, just take that deep breath and send some love. And know that we're all here collectively holding that loss together, and that we're not alone. So thank you for that pause. All right, moving on to the presentation. A little bit about Brave. So 2016, the epidemic was declared a national emergency in Canada. I believe it wasn't called a national emergency until 2018 in the US. I could be wrong. Please don't hold me to dates. More importantly, I was walking around this beautiful town of mine and going about my daily work, and people were literally dropping on the sidewalk. And it was confusing, shocking, and it was really difficult as someone who provides service and Narcan and overdose response, to be walking around a city and suddenly see, like literally see, bodies dropping on the ground. It was a really difficult time, and we all started, all of us service providers, all of us allies started looking around at like, how can we get Narcan into the community? How do we get people to go to supervised consumption sites? How do we provide service, connection, and gathered together? And there's been quite a bit of what is now considered best practice in harm reduction that started and was inspired by what was happening here in Vancouver. Gordon had been doing a bunch of research on, would people use technology to provide social connection in times when social connection is something that is needed to save lives or to make people's lives better, to increase their quality of life. And Mario, Gordon, and myself met in 2017, 2018. Early in 2018, and they told me about this amazing idea that they had and these tools that they wanted to offer to the world that would help end social isolation. And as someone who came from a social justice background and was really involved in frontline work, I was like, technology. But after looking up from Vancouver and from the work that I was doing at the street level, I began to see how technology might be able to actually increase the reach of community connection and connecting people to services, to other people, to peers, to so that we're ending the isolation. The beautiful, and it became this beautiful idea of like taking what this community had created, talking with all of the drug users, service providers, meeting with thousands of people over a period of 2 years to develop a set of tools for specific situations where people are in isolation and dying of something that is reversible, and that if there is a person who's able to respond in time, deliver Narcan, rescue breaths, get people to a hospital, if that's what ends up happening, that fatalities would actually be diminished or reduced, and then see what was working here, and then start to spread that out to the world at large, because that is the beauty of technology, is it can grow in sort of exponential ways. So we formed this organization called Brave Technology Cooperative, which is based on 4 very simple but very intensive modalities. So we use something called design justice, which I talked a little bit about a few seconds ago. And the design justice is that we co-design the product developments with all of the people who are involved in so that all of the people, okay, incomplete thought, give me a sec. So design justice is incorporating drug users, people with lived and shared experience, people with living experience, people who are impacted by drug use, businesses that are shutting their bathrooms because they don't want people using drugs in there, public health organizations, behavioral health organizations, and really trying to outreach teams, basically trying to bring everybody into the fold and help us design a tool that is going to work to create connection in between someone in need of support and someone capable of giving support in that moment. And it was extremely important that all of that is based with the people who will be using the tools, because if you help build a tool, you're more likely to use it in the long run. Another one of our values is we have transparency, so you can go to our website and you can see all of our financial records, our whole team, all of our processes, our ethos, our pathos, our challenges. You'll see all of our humanness exists on our website, and we publicly share all of our company information. We have this idea that in having transparency and in creating an open, it's not API, what is it called? Like this open source, that for issues that are coming up for other organizations, that they can see what we're doing, and they might be able to adopt our technology and build it for something that's going to fit their modality or their region a little bit better. We are a cooperative, and our cooperative, we have a workers cooperative. We have 3 levels of cooperative members. So we have investor members, cooperative worker members, and then we have what's called the end user member. So anyone who creates value for the products is engaged in a democratic process for governance for our organization, as well as if we ever were to have a profit, that would be split in a equitable way across the different memberships. What's interesting about that is we are not a profit-driven organization. We are a mission-driven organization, and we are cooperative, which enforces and contains our mission to what it is that we're doing in the world and how we roll about doing that. We like to think that we're trauma informed. I think it's more that we acknowledge and pledge to address when trauma, whether it's community-based or personal trauma, that it's inherent in the work, and that we will do everything that we can to address holding space and changing some of the methodologies that we have in, like traditional methodologies, so that we're able to hold space for folks who have experienced trauma and communities who have experienced trauma. Moving on. Again, it's really hard because I can't gauge. Hi people, I know you're there. So we're going to talk a little bit about the tools before we move into the brave technologies that we have. If anyone has any questions about what I've talked about so far, now's the time to throw that into the chat or the questions answer. So just that we give a pause at this point. And all right, looks like we don't have any questions yet. So good. My rambling has succeeded in hopefully answering everything that came across your mind. We're going to talk about the tools. I'm going to hand it over to Gordon, who is going to walk us through our 3 tools. We have buttons, sensors, and the app. Take it away, Gordon.
Thank you. Yeah, thanks, Una. Everything sort of comes under that context. So it's really important from our side to know sort of why we are, as much as what the things are that we ended up designing with everybody else. So the 3 things, these are all sort of they're in the world already, so they're all available. The buttons are, I forgot to bring a button. The buttons are about this size. They're simply put, they're smart buttons. They can stick on a wall and be taken off again. They run on battery power. We put them into predominantly supportive housing, shelters or SROs, depending on the language you might use. And the analogy is like a nurse alert button, and you're just pushing a button and someone's coming up and responding. The second thing, and we're going to talk a little bit more about each of these. The second thing is a sensor. So the Brave sensor, like a smoke alarm, you stick it on the ceiling in a washroom, and it's doing 3 things. The first thing is it's a timer. So as soon as somebody comes in, it starts a timer, and it'll send you an alert for whatever amount of time you want in your location. The second thing is it's looking for a lack of motion. So if somebody's in the washroom and they stop moving for, let's say, 8 to 10 seconds, it'll send an alert. And the last thing it's looking for is if you are motionless and your breathing rate is below 8 breaths per minute, it can detect that, and it will send an alert for that. The last thing is the app, and the app is the first thing we came up with, and it's a digital remote supervision tool. So supervised consumption is not a thing in the US yet. I think Philly's gonna hopefully have something coming now that the new DOJ is running the show. We'll see, but this is a tool for anybody who wants that same service and is willing to take it through technology. And so similar to the never use alone phone line, people use the app to get connected to another human being who then stays on the line with those lines necessary and sends help. So in a little more detail, there's somebody endorsing us on the App Store. So the buttons are really simply, you push it once to get somebody to come up and just check on you, make sure that you're okay. The idea is you can push it multiple times to indicate that there's some urgency to your request, and people do that, and that can be for safety or sometimes for if you suspect your neighbor is in jeopardy or potentially even having an overdose, and there's just a light there to show that if it's not connected, which can happen because you might lose electricity, your Wi-Fi might go down, connects by Wi-Fi, and it'll show red so that it doesn't work. And just another indication of the process is the staff, because these are all supported buildings. If the staff receives a notification, they come up and check. And the technology is that it's going to something called the hub, which is a Bluetooth hub, which is controlling or just looking at the data and determining when and where to send the messages to. We've been installed at one building in Vancouver for 2 years, and then another 4 buildings for a shorter period of time. In that time, there's been a lot of overdoses, as you can see, so 50 overdoses that have been tracked through the buttons. There's been 150 at least violent incidents that have been de-escalated through use of the button, and then 169 cases where the resident has disclosed to the staff member that they were using in their room at the time, and that the staff member obviously checked that they were okay, and they were okay. The other presses, the 2,226, were moments when somebody pushed the button and somebody came and checked on them. And there's a lot that is implied in that. There's a lot of connection happening, there's a lot of care happening. In particular, over the past year, I suppose, that's a lot of isolation reduction that's happening there. Una often asks, like, how do you calculate or quantify the value of a hug? And this is like a hug, especially in COVID times when we can't actually hug. Somebody coming up to your door and checking on you when you ask them to, not once, not twice, but every single time that you push that button, is a pretty miraculous thing, I think. The sensor is 2 sensors actually. It's a door sensor as well as a radar sensor. It's really, really sensitive. So if you're thinking of sensors like the light sensor that is in a lot of bathrooms, if you're like me, you might have the light go off while you're in the bathroom and you wave your arms, or you have to move yourself in some way to get the light to go on. This is not that sensor. This is a 3-dimensional radar sensor. It's Doppler radar, just language that I don't really understand, but it's words that I can use. But if you were to, for example, be sitting on the toilet and you're just scrolling through your phone, it's sensitive enough to pick up that. So we're using this technology to try and reduce the number of false alerts or false alarms. But as the sensor is detecting a lack of motion or a time has elapsed for your staff, so your staff might have a washroom safety protocol, which might require a staff member, amongst the other 700 things they're doing today, to be checking visually as somebody goes into a washroom and then counting either mentally or perhaps with a stopwatch if they're there for longer than 10 minutes or 15 minutes or whatever your protocol might be. So we're just automating that to make things a little bit easier on everybody. But then also, of course, if somebody is motionless for 8 seconds, then we'll send an urgent alert. And staff are getting that notification again on their phone to show that you need to respond because somebody's been in there for longer than 10 minutes or because it's they've stopped moving. The sensor, as I said, has this capability to detect if the breathing rate goes below 8 breaths per minute. But to date, that's never actually been activated. So usually the lack of motion is activated prior to that. In testing, we know that it works, but it's never been activated in the wild. And this is, again, as I said, this is out there. We calculated using our own calculations that about 3 people per day of the overdose deaths that we think are happening right now are probably happening in publicly accessible washrooms, even given all the closures, and there's still people dying in these washrooms. We're currently in a few locations around Vancouver, about 18 bathrooms, and trying to get this into as many places as possible because we think it can make a really big difference, both to the staff and to the numbers. The app, again, as I said, really simple. It's just remote supervision. So you're one person using alone in your home or at work, wherever you are, but you are able to connect through the app to another human who's on the other end of a phone and on the other end of the app, and they stay on that line with you until you feel safe. You are able to design a rescue plan, which will fit actually you're able to design many rescue plans. So you might use in multiplicity of places. You can have a different rescue plan for each of those places. At home, you might want your neighbor to be called or your mom to be called. Whereas if you're somewhere else, you might just want 911 to be called. You can opt in or out of 911 in terms of what kind of response you want, and that's all customizable. It's all anonymous. You don't need to create an account. You can see in the screenshot up there, it's good evening friend. It's not doesn't necessarily have to know my name, and all that data stays on your phone unless and until you become unresponsive. So if you become unresponsive, then and only then will your details be revealed to the supporter, the volunteer on the other end of the app, and then they activate the rescue plan that you had chosen for that specific call. And the app it's been live since the 5th of April last year, and we did a massive re-release in December, which completely changed the look and feel, and we think that's very important. We know that a lot of people downloaded the app and were pretty confused by the user interface and the first version of it. So we've changed that completely. It's a lot simpler now. It's what you just saw. We have a lot of volunteers signing up to be supporters. We have 163 signed up. We don't have that many active, and because we don't want people sitting on the line waiting for calls. We're still only getting about 10 calls a day, and those aren't the same 10 callers, but it's in our mind a massively underutilized resource, and we love to see more people use it. People do love it, and we've learned that it creates a phenomenal sense of connection, which is intentional. Like we built it because knowing that it had the potential to create connection. We didn't put a robot on the other end of the line on purpose. That was very intentional, and very much feedback that we heard from people with lived experience. Like they didn't want to speak to robots. They didn't want an app that was impersonal or not human. And those conversations, while folks are using, it's the same kind of conversations that you'll be having at needle exchanges or at supervised consumption sites if you've ever been in there. People are willing to share really, really deep things. They're looking for support and connection, and they're looking to be validated in their experience, and being seen as a human and being cared for in that moment of supreme vulnerability while you're using and while you're at risk turns out it can be a really beautiful thing.
There's a question.
But there's a question.
Yeah, sensor related from Monique. So what does the notification look like on the sensor?
So today the notification is a text message, and that is a chatbot actually. So the text message comes through and says that somebody is in your washroom and you need to go and check on them. Please click OK once you have checked on them. Or please type OK once you've checked on them. And then when you type OK, it says like, please classify what happened. Like, is everybody okay? Was it a false alarm? Was there an overdose, or did they need further attention or other? And that's changing in about 2 months. We're shifting to an app. That's what the notification looks like today.
Then we have another question. What kind of training is needed to be considered a supporter?
We have a whole thing.
We have a whole thing. We have a supporter training. I don't know, it's like system. So it is the kind of training is, do you mean like what kind of training is it, or do you have to take our training in order to do it? I don't know if that is more helpful.
There's so I have a link at the end of the presentation for the supporter resources of where you can learn about it. It's bebrave.io is the website for the app specifically, and then /support. But if you go to the Be Brave website or you go to brave.gov, you'll find it. Yeah. Essentially, we have a bunch of reading and some videos for people to watch, and then we have an in-person scenario training session. And so once you've gone through those and you're happy that you feel confident in doing it, and we're happy that you know the tech and that you're not a narc, you love people, and then you'll be put on the line.
Yeah. So it includes some active listening, conflict resolution, de-escalation, mental health first aid type information, as well as safer use practices, safer and potential resources, like future resources for folks if they're having trouble finding a vein, or suggestions to maybe try a skin pop first as like a granular example, if they're IV use. And there is ongoing support for the supporters in a WhatsApp chat where all the supporters support each other. So if they're having a call and they don't know all of the answers, or they're having a little bit of difficulty, they can just put out to the WhatsApp. So we have that sort of like staff room environment in it. And then the other training is the tech, just to make sure that you feel comfortable on the tech. And people can circle through the different scenario trainings and the one-to-one or the group Tech Fridays for as long as they want. Some people went through the training in a couple of days, like a week, and then other people went through the training and it took them 3 or 4 months of like practicing and engaging with harm reduction practice in order to feel confident answering the phone or answering the app and talking with people who are actively using it. The app is absolutely available in the US. That was a big piece of work that we wanted to make sure that the app was available in both Canada and the US. And we have future visions of it being available in other places like the UK, Scotland. Is the UK part of Scotland? Wait, sorry. I'm sorry. I apologize. I don't know my.
Maybe not for long.
And Mexico, like places where continental Europe, places where overdoses or people are using alone in isolation. We want to be there. So.
Yeah, just because you asked about the US specifically, so it is available there. One of the challenges was ensuring that we could connect with 911 across the US. It's a very distributed system, I guess. Very independent operators are all around the place. So we just, again, in December, when we did this relaunch of the new interface for the app, we simultaneously integrated with this tool called Rapid SOS, which allows us to connect from anywhere, including from Canada, with any US 911 dispatcher. So it says 96% here, but that's for data. So 100% of US 911 we can connect to via voice, and then 96% they're actually getting a data package from us at the same time as we connect via voice. What this means is that on their end, they immediately get the address details and all the location details without having to ask us any questions, which saves minutes potentially. They also get the context, so they're told that it is an overdose or a suspected overdose, which theoretically should bump the call up to the top of the list. It should also immediately classify it as a medical situation versus one that might require police presence. And I know that the reality of 911 response is different in every single place in North America. So just because it's classified as medical doesn't guarantee that you're only going to get paramedics out there, but it does classify it that way. The third thing it does is it gives the dispatcher the information that of what this is, and what this is remote support for people who are at risk of overdose. And the analogy that they're getting is that this is like a crisis support line. This is like a suicide prevention line. And we are optimistic that the fact that they have all received training now as of our integration around this is in itself a small act of destigmatization of this, because if you're thinking of us the same way as you think of like senior care and response, like a lost person who's suffering from dementia, or you think of it in the same way as you think about folks who are at risk of suicide, then that's just another humanizing thing that might have happened.
That's very exciting stuff. And just to be clear, the 911 is an opt-in, and what we've been seeing with the protests in the Black Lives Matter movement and the over-policing and over-criminalization of all of our kin in the US, we want to make sure that we are very much aware that we're not trying to like ingrain a service or provide a service that they wouldn't use because it's not going to work for them. So having options is really important. We have another question here that says, for new users, how long does it take them to onboard onto the app? There's 3 questions, so I'll answer the first one. So essentially, you can download the app and make a call right away. You don't need to have, and it'll be an anonymous call. You don't need to fill out anything. So however long that takes. Do they need to create a rescue plan before they can get supervised use? No. One of the benefits of being connected to a person is as a caller is getting support, the supporter can actually fill out a rescue plan for them if they have one, or if they have something in mind. And what if they don't have anyone they feel safe as having as their contact in case of overdose? Yeah, this is a really great question. And so we do encourage people to think deeply about who they would want to respond. And they might not give us a contact the first 3 times that they call, and they might not want us to call 911. And at the end of the day, the most important part is like they're not alone and we're on the phone with them. And that's how we're able to provide support. The more that people are using the phone or using the app, and the more that they're trusting their relationship with the supporters, the more they're beginning to process the idea of looking for supports close to them. And so we've seen people go from like, I'm not telling you anything, kind of go fuck yourself. I just want to make sure there's another person on the phone. And we're like, cool, I'm here. I'm just gonna, let's chat, what kind of music are you downloading this week? Or what are you into? Or, let's not talk at all. Whatever that conversation needs to be.
And we've seen people have nobody who could help them at the beginning and not be willing to call 911, and then one of those things might change or has changed.
Yeah.
Either they say, you know what, it's fine, and then they need to get permission on the app as well. Or they think of this one person who previously they didn't think it was okay, but now as they're actually imagining the situation with our volunteers, they're saying, okay, you know what, you can call my son. Like we'll have a big fight about it afterwards, but like I have the Narcan next to me, he knows how to use it, and it's fine. Like if something actually does go wrong.
Yeah.
So
fantastic. Excellent. It looks like we're ready to move on to this next question. So if you have any other questions, just throw them into the chat and we'll get to them at the end. Yeah, let's talk about COVID. So COVID-19, it's just put a huge dent in everybody's life. So in BC, as well as a lot of other places, the same amount of people, double the amount of people from last year? In last year, died of OD, specifically due or correlated to the safe supply or the drug supply. So the toxicity of the drug supply has increased as drug trade has, who knows what's going on with drug trade. And using alone is a preferred method for many people. And also people are being told to not use alone and also socially isolate. So lots of different housing projects have gotten conflicting information. So you're not allowed to have any guests. It's increased the risk for people who are using alone inside of the rooms. And COVID has really impacted human connection. And this is why we actually put the app out early. So we were going to be putting it out in December of 2020. We ended up putting it out in April, and the reason was we knew that when the COVID protocols hit, that it was going to be very very detrimental to our people. And so one of the reasons that the app is such a great solution is that it does help people connect to another human, and creates a sense of value around the life that they're living. Yeah, so that's all I have to say about COVID. So tired of talking about COVID. It's going to talk about it for 2 more years.
Yeah, so the other thing is there was a group in Ontario who were inspired by the Never Use Alone phone line in the US, which we've been long admirers of. There's a lot of mutual admiration between Mike and us. And so they set up this province-specific line, and they were trying to set it up nationally. And so we joined forces in August-ish of last year, and then put it together. So we launched a phone line in Canada. This is really helpful for us, or it makes us feel good, because the idea of each tool is trying to meet like a different aspect of the same need, and meeting the needs of folks who don't have access to the internet through a phone line has been it's a joy to do it. But we also couldn't have done it on our own, so it's great to be partnering with the Grenfell Ministries, is what they're called, out of Ontario. So that was another. This is just the stuff that we've done most recently. Other stuff that's on the way are just additional features in the app, so chat features, and people being able to use something similar to a timer. It's not quite a timer, but to be able to connect with someone who's going to sort of do more time manage things. So folks who don't necessarily want to use voice as a way of connecting, but to use other tools while a human is still connecting with them. And those are all coming.
And more importantly than those features, you can see why we run this together, is one of the things that we're looking at doing and that we're working on specifically in Ohio with the public health and harm reduction coalitions in Columbus and outside, is we are trying to be able to ask people if they would like to opt in to regional resources, which would then, so if they opted into that, then they would be able to see different types of care. So whether that's MAT, safer supplies, syringe exchanges, housing, treatment, whatever that looks like, counseling, like, and what we're working on right now is enrolling the different regional service providers into the app, and then making sure that we're able to develop the app so that it pings off of where the person is calling from. And that is some really exciting work that has been put on hold several times because of stupid COVID. But it is some of the work that we're doing, and it's something that I'm hoping that you might imagine yourselves be part of. So we work with all different kinds of service providers and harm reduction organizations, everything from grassroots to like governance, like governmental organizations, trying to see how we can integrate and activate the space in between the different silos. Because we'll have proximity to people who are in need of support, and they have all of these supports available. So how do we show people who are using us as a support that there are opportunities for other types of support out there as well, and create that active network, create a living organism of activation and networking, as opposed to what's happening right now, which I see the division and siloing that happens in the States. Oh, there's a great picture of me and Tracy last year at the first Harm Reduction Ohio group, and yeah, so we would love to be your partners. We want to be your stakeholders. We'd love for you to be ours. We'd love to work together, and I'm hoping that you'll get in touch with us. If you have any ideas on how that might work for you, or if you're interested in any of the tools, or even if you're just interested in some solidarity and a sense of like, you're not doing this alone. So we are always open for that. The app is called the Brave app. So if you look at it in the Google,
You won't find it under that name right now, for which I apologize. There's some name confusion, but we do have flyers, and there's in this slide you can see there's a publicly available documents thing where you can find all of our stuff, and I'm going to share this with the team, and hopefully they can get it all out to you. But we have a bunch of media and things that you can share yourselves, including we're doing one with an Every Alone phone number on it as well, so that you can pass out both of those bits of information at the same time. Thanks. So yeah, you'll get a copy of this presentation with all of these links at the end. The information is protected from law enforcement, but primarily through us not collecting it. So we don't, or firstly through us not collecting it. So we don't collect any information from anybody unless and until they become unresponsive. At that point, their location information and their phone number is shared with us, and passed on to first responders or EMS type responders if they've clicked into that, if they've approved that. Otherwise, it stays with us, and we try and get response out through their preferred contact. We then delete that information every 24 hours. So we scrub our database every 24 hours and don't keep any of that for longer than that. And we scrub that location information every 24 hours. We scrub all of our information every 7 days. So we don't keep any data. We know that researchers hate us for this, but we're not averse to doing research. We just want it to be specific and for people to have the opportunity to opt into research, in which case that would be managed separately. But yeah, that's the primary means in which we do it.
Great. Yeah, another piece on like the kind of data that we do collect is out of 176 phone calls, there are 176 answers. That's the part that we're really the most interested in, and we would consider that like a total success of the for every button pressed, there is a person going and knocking on a door. For every time that someone stops breathing in a bathroom, there's someone coming and doing a response. So we're not qualifying any of the other data. We're not selling any data. We're not interested in data collection. What we are interested in doing is accelerating, activating overdose response as quickly as possible with the least amount of sort of like stigma and moral issue. We're just hyper-focused on the moment that a person is the most at risk of fatality and providing that moment with a sense of safety. Is there a non-English speaking person's version? Absolutely. We are, so
No,
good point.
Not really.
Not yet. But what we are looking for is supporters and volunteers who would be interested in helping translate some of our help me out, what is it that I'm looking for? Website?
What? Yeah, so to translate the stuff for the app. So we're doing translations. It's actually the first thing that we wanted to do after the re-release in December. So what we did when we re-released it, it's way TMI, but like technically the infrastructure is now in place in the app for us to have a multiplicity of languages. And we need to do French and Spanish, or we're going to be doing French and Spanish first, French for our French Canadian friends, and Spanish for the large Spanish speaking population primarily in the US. But after that, we actually want to have a shit ton of languages out there. The challenge though is what Una is talking about, is like getting you connected with another person who speaks the same language as you. So having that support on the line and how to do that. And we think part of the solution is going to be for some of that support to be less based on a human speaking the same language and more about the technology interacting and finding the support. And in terms of accessibility, it's not something we've done really well on so far, but it has been pushed like really high at the priority list for going forward, ensuring that the tools for people who are vision impaired, people who have other kinds of challenges are able to use the app in a meaningful way. And definitely when we think about using text or using these timer-based options or something like that, we are thinking as well as just generally we're thinking about people who have hard of hearing or hearing challenges.
This is where we say, if anyone has a mandate to be creating new resources, we'd love to work with them in other languages. We do have flyers. Some of them can be found at the links, but we'll also make sure, so we do have a resources folder on our public docs, which is in the bottom link here. And there are flyers, so yeah, different kinds of PR things. So people, like we have our own, we're happy if you want to take that and use that to promote that in the community, but we also have lots of different organizations who have made their own for their area, using the input from different community members, and have pushed those out. And then we have a collection of those. We don't own, we're not worried about branding or anything like that. We don't own that. We just want the information to, you know, each one to get it into the community, so that we're able, so that people are knowing that it's a resource. My computer is just about to die.
Okay.
Kirsten asked a question. I'm going to grab the cord. Yeah, and sorry.
Yeah, so the design justice work, the emphasis on working with folks with lived experience, it started with me having a conversation with Anne Livingston, who you may know was one of the main people behind the Vancouver Area Network of Drug Users, the first drug user union in North America, 20-something years ago. And Anne just really like laid into me in a loving way, saying, you know, it's really imperative that you ensure that the experience of folks who use is central to what you're doing. This is like right after I got to Vancouver. I managed to meet this living legend. And from there, it was literally just a case of going out and talking to people a lot on the streets, in the rain, in the winter, you know, getting Narcan trained, obviously, and reversing overdoses myself, but working with people at the overdose prevention sites here and just chatting with them. And then we hosted design jams where people came in and were paid for their time and their expertise. And these are effectively consultants with expertise and a huge amount of value to add. And we tried to ensure, we did ensure that their time was recognized appropriately. And a shit ton of listening. Una, before she came to work with us, had a group of people that she allowed me to come and chat to. But really the chat was just about me listening to what they had to say without really presenting the idea for the app or anything as a baked deal, but just saying like, hey, technology, overdose prevention, what do you think? And they all had amazing ideas and amazing input. And there is the question as well about working with the potential to work with other health departments and state and local agencies, like how that might go about.
Excellent. Just a quick thing on the peer model. So part of the work that I used to do before I was with Brave was peer networking and helping ensuring that nothing about us without us was being held accountable, holding the government organizations and the public health departments accountable to that framework. And so, like Gordon was saying at the beginning, he had originally contacted me to see if he could be in touch with my peers, and I was like, I don't know, what do you want? and yeah, so that was kind of the beginning of some of that peer networking. Here we have in Canada and throughout the US, we have all of these amazing survivor unions, drug user unions, peer networks. So we've been able to really sort of tap into that, you know, huge amount of experience and lovely zestiness that goes along with peer work.
Just two quick ones. The sensor, it has a monthly fee, and the monthly fee is per building. So if you have 4 washrooms in your building, it's $95 for the building, and not on a per sensor basis. The second question was just about only having phone lines. So we recommend people never use a phone line. We don't have a phone in line into the app yet. That's something that's coming by the end of the year. But in Canada, we're telling people to use the NORS line, the National Overdose Response Service line, and in the US, they never use a phone line.
Ohio?
Yeah, other ways that people could work with us, with health agencies.
Great. So, Ohio was a really interesting experience. We landed there magically by applying for a tech grant. And when we won the first phase of this tech grant, we went and we just started, we hit the streets and saw what services are available, what's going on. And we met a bunch of lovely humans in different harm reduction organizations, people who are passing out Narcan and food and fentanyl test strips, people who are doing that on the fly, a few nurses who are doing outreach, SafePoint, which I'm going to shout out to my SafePoint Equitas folks. I don't know if any of you are listening, but you're amazing and we love you. And we just kept getting introduced to the next layer. So by hitting the streets and doing that grassroots work, we eventually ended up in public health that is funding all of these different projects. So that being said, that's how we landed in Ohio. And we had thought that we thought the US was going to be a lot different than Canada, and actually it's really, really similar in the way that harm reduction comes about being. So it actually seemed really easy for us to start working in partnership with this multi-sector stakeholder group is what I would call that. And beginning to see how we might be able to get everyone out of their silos using the technology to create that network. So for the foreseeable future, what I would love to do is to talk with any regional task force that have that complementary people with lived experience, grassroots organizations, public health resources, different types of MAT or behavioral health supports, and come into that into that room and see if we might be able, how we might be able to create that regional network using, for example, the app. I hope that is clear as mud at this point. I'm losing my focus. I'm losing my focus. If you have any other questions about that or considerations, or you had a light bulb go off and be like, I totally know how we could work together, it would be so great, please contact us. And we love talking to people and creating these alliances. And yeah, let's work together. It'd be great.
Thank you.
Thank you. I think that's it.
Thank you so much to both of you and to all of our attendees and participants who have been submitting questions. We've got a little bit of time left. As always, want to allow people to make the most of their afternoons. So happy to wrap up a little early, but want to make sure that if there are any outstanding questions, that we're able to get to them. Any connections or opportunities that you wanted to share with our brave friends. Feel free to put those into the question box. I think we also have the possibility of unmuting somebody if they'd like to talk, if people prefer that route. And thank you, yes, to Kirsten. We will be sending out the recording of this presentation, the slide deck, the links that have been shared following the broadcast. Any closing questions to get to? If not, I'm happy to give people back 15 minutes and just appreciate everyone's time this afternoon, interest, and all of the rest. And we'll look forward to some follow-up and hopefully making some connections and seeing where some of this information can take us. Sounds good. Thank you, everybody. Have a wonderful rest of your day.
Thank you.
See if I can end a presentation now.
Would I be able to contact someone to get flyers on the, yeah, absolutely. Issue with accessing Google Drives. Okay.
Hmm.
There's just this one question that keeps popping up.
They couldn't access the Google Drive.
Yes, just a lot of appreciation. So thanks, everybody. Okay, I think probably the easiest way to do this is to just close it. So goodbye. Happy Wednesday.
Bye.